am doing the endoscopic discectomy of Mr. Shishir from Nepal, and patient has left L5 and S1 disc, which is compressing on the S1 nerve root, and I am doing it under local anesthesia. And as you can see on the screen, the nerve root is already clean and nerve root is pulsating, and nerve root is pulsating and nerve root is technically free from the compression. There is no compression if you see, and the surgery is almost over, and the patient is under local anesthesia. My patient today is a very special patient. He has come from very long distance. His name is Shishir, and Shishir is a medical professional himself. He works in Department of Anesthesia, and Shishir has come from a different country altogether. He has come from Nepal. So Shishir, can you tell me what problem you are having and since when?
Dr. Sir, namaste.
Yeah.
I had severe leg pain 2.5 years back, and I waited and did many conservative approaches and many Ayurvedic
treatments,
alternatives.
Yes.
But that didn't improve me, and और धीरे धीरे मुझे ठीक भी लग रहा था, और I was hoping that I would get better on
with the conservative therapy.
Better on its own.
On its own, yes, because it improves sometimes.
And I waited, and it improved
to some extent.
To some extent too. But धीरे धीरे अभी 2-3 months से मेरा knee pain भी हो रहा है.
Yes.
और मुझे वो weakness जैसा थोड़ा weakness जैसा लग रहा है.
In the left leg,
in the left leg, I feel
weak, a bit weak. And this has happened for last 2-3 months now.
I think 3-4 months. Yeah.
3-4 months. Okay.
But I wasn't okay since 2.5 years.
Okay. So the pain kept on coming and going back and like that.
Yeah, but there is no a single day that
you never had pain.
Yeah.
Every day in 2.5 years you were suffering.
Yeah, suffering, but I adjusted with it.
Adjusted. So and you have a very difficult job as an anesthesia person. You have to work very hard, long hours. So how did you manage your life and pain together?
Yeah, my supporting doctors and supporting staff also helped me. That I couldn't. I must not do
heavy work and too much work.
And they helped me.
They must be very nice and helpful.
I was comfortable with my work in chair.
Yes.
So I leaned in and hoped for its own
recovery. But it did not happen.
It didn't happen now.
And it must be 2.5 years already for the pain. So Shishir, tell me one thing. Nepal, which place you belong?
I am from Butol. It is nearby Lumbini.
Lumbini, near Gorakhpur border.
Yeah.
So how much time it took you to come to Agra, because it is very far journey?
It's too far, and I think 15 hours of journey.
15 hours of long journey. So Shishir, why would you not get this surgery done in Nepal? Why would you want to travel all the way down to us?
Actually, I work in surgery.
Yes, you know in and out of surgery in detail.
And I don't like surgery.
Yes, nobody likes surgery.
Because if muscle are injured, then if muscle are cut, then it would injure. I feel like that.
Yes.
So
it will lead to scarring of the tissue.
Yeah.
Yes.
So minimal invasive. Where do minimal invasive happen in Nepal? It is not possible. Actually, not possible. If it happen, but also there is no so much experienced doctor
for doing the procedure.
Endoscopic procedure. So I
decided to come to
Agra and to actually Dr. Devashish Sharma.
Okay. So Shishir, tell me that because his case is a very special case, he has left-sided L5 S1 disc herniation, And many people around the world think that L5S1 is not possible transforaminally under local anesthesia. That
even I thought
it's not possible. He inquired with me that L5S1 is a serious ball game because some people may have told you that it's not possible to do endoscopically.
yeah, and many doctors told me to.
Yes, that it's not possible.
Yeah.
So, but ऐसा नहीं है. I believe L5S1 can be done transforaminally under local anesthesia, provided if few things are taken care during the time of surgery, like if there is no high riding iliac crest, and even if there is a high riding iliac crest, you can always go transiliac. So L5S1 ऐसा बिल्कुल भी नहीं है. It is not true that you have to go give patient general anesthesia or you have to do interlaminar. So he dedicatedly wanted that no muscle should be injured. He dedicatedly wanted that no bone should be injured, because in the long run he knows, because he is a part of our group actually. He knows the back end that long term scarring of tissue will lead to further problems in the spine, and he doesn't want it. So Shishir, are you afraid of surgery?
Actually, my personality is that I am very anxious.
Yes.
But why I don't know. But today I am not afraid.
You're not afraid? Because you know we are not intubating you. We are not giving you anesthesia. It will be done under bupivacaine. I think that's why he's not worried. So Shishir, we will talk to you after surgery. Tell me how much you are comfortable standing and walking.
Okay, I have to, I think, demonstrate.
Shishir, how much you can walk and stand?
If I walk with pain, then I can walk about 1 hour or 2.
With pain, but that will be without pain. How much you can walk?
Without pain, I don't think that I can stand 5 minutes also.
After 5 minutes, the pain comes into your left leg.
Walking is a bit good than standing to me.
Okay, it's more painful to stand at one place for a long time. Is more painful as compared to walking.
But while sitting, I don't feel so much of pain.
So this is a very important sign, my friends. I want to tell you that if patient is not having sitting pain, that means the spine is stable in itself. If you just decompress the nerve root, the problem will be solved forever. So let's talk to Shishir after the surgery, and then we will discuss how is he feeling after that. Okay, thank you. तो हम लोग मिस्टर शिशिर की एंडोस्कोपिक डिस्केक्टमी कर रहे हैं. I am doing the endoscopic discectomy of Mr. Shishir from Nepal, and patient has left L5 and S1 disc, which is compressing on the S1 nerve root, and I am doing it under local anesthesia. And as you can see on the screen, the nerve root is already clean and nerve root is pulsating, and nerve root is pulsating and nerve root is technically free from the compression. There is no compression if you see, and the surgery is almost over, and the patient is under local anesthesia. Mr. Shishir, are you okay? Have I given you any anesthesia?
No, just
only under local anesthesia, and my patient can, whenever I touch the nerve root, patient can tell me in a real-time feedback that there is some issue with the nerve. So, are you able to appreciate your nerves and current in the leg? No, not now, but whenever I touch your nerve, are you able to appreciate?
Yeah.
So the good thing about this procedure is that patient's nerves are very safe. So my patient can tell me whenever there is a problem. Patient can tell me that there is no compression of the nerve or irritation of the nerve when I am doing the procedure. So whenever I am doing the procedure, my patient can comfortably tell me that there is no nerve root irritation or compression. And the procedure is almost complete, so he will be relieved of his problem very soon. Thank you. So Shishir came to me as a patient of prolapsed intervertebral disc L5S1 on the left side. So Shishir, you came for endoscopy, right?
Yeah.
So how was your experience of endoscopy?
I had good faith on you.
Yes.
So I was not so in agony.
You were not in lot of agony. Pain was mild.
Pain was mild.
Yes, pain was mild. So we were able to operate him with very mild pain, and we did not give. Did we give you any anesthesia?
No, it was totally on local anesthesia.
Local anesthesia. So do you believe that the safety of the surgery increases a lot if there is no general anesthesia?
Yeah, I can feel myself.
Yes, and you can feel the nerve roots.
Yeah.
And whenever I touch the nerve root, he can guide me that you are around the nerve. So I become more careful. So the message is that local surgery is much more safe. And one more thing, that it involves very less trauma to the muscles. There is no scarring, and muscles remain very safe. And that is the reason Shishir came traveling all the way from Nepal. So Shishir, tell me, how is your leg pain now?
I think leg pain has drastically improved.
Drastically improved. In percentage, how much do you think it is improved?
Up to now, I hope it has improved more than 80%.
More than 80% is the pain relief, and it is not even 24 hours we have performed the surgery.
Yeah.
So he has walked, he is very comfortable. However, since he had the leg back pain element also, so as I want to tell you that back pain may remain for some time, and when you start exercising it gets better. But generally speaking, leg pain after the surgery is gone very fast. So tell me, Shishir, one more thing. This video will be watched by many people. So do you think there are many people who are afraid of endoscopic surgery? Do you want to give any message?
Myself, I was also afraid of spine surgery, so I waited for very long years.
Yes.
Now I want to say every people who is watching Dr. Devashish video, I want to say don't afraid to have spine surgery in good hands.
It is safe.
It is absolutely safe. I can feel very good. I am feeling very good. It is very safe. So don't
Be
make a quality of life
Compromised.
compromised.
Yes. So, and the most important part is Shishir is not like a normal patient. He himself is a anesthesia person from a medical field from Nepal. So he knows surgery in and out. So many patients he has done anesthesia. So he knows things very well in detail, and he has seen me operating. So he knows that it is important to respect the muscle, to respect the tissue, and tissue should not be damaged. And open surgery, sometimes there is a lot of damage to the tissue which becomes a permanent problem. And in this surgery there is just no damage, only you dilate the tissue and then you come back without anything. So I think I am very happy, so congratulations.
Thank you, sir.
Okay, have a good day.
Thank you very much. Thank you, sir.
Okay.